Hi, this is Dr. Horacio F from Buenos Aires, Argentina. I would like to share with you the use of the 3D simulator software and a 3D print biomodels to aid autologous breast reconstruction. I have no conflict of interest. As an ancient Chinese proverb said, a picture is worth 1,000 words. So here we have a lady who underwent breast reconstruction with an abdominal base flap. And although the reconstruction in terms of volume is pretty well, the reconstructed breast is totally different in terms of shape or height, width, or projection. So we all know that all breasts are different. So before a breast reconstruction, we need to do a proper volumetric and shape planning. For volumetric purposes, there are a number of methods like the Archimedean principle, the thermoplastic casting, the anthropomorphic measurements, and the use of images like the mammogram, the CT scan, the MRI, and the 3D imaging. The CT scan has a problem that the patient, this study is carried out with the patient laying down on her back. Therefore, the breasts are displaced laterally and the shape of the breast is completely different. The same happened with the MRI that is carried out with the patient laying down on face down, and the breasts are hanging, and again, the breasts are completely different in terms of shape. The advantage of the 3D imaging is the studies carried out with the patient in standing position, therefore, the shape of the breast is the proper one. And the advantage is that they're easy to use, is quick, exact, and reliable. We can do both planning, morphologic and volumetric planning. And with these images, we can create custom molds or biomodels. However, the problem is the price. Therefore, we are doing a morphologic planning in terms of height, width, projection, orientation, and shape. The 3D technology involves the use of the 3D laser scanning camera, a stereophotogrammetric camera to obtain 3D photograph. And again, the cost of this technology is too expensive. So and all the previous studies involving the creation of biomodels for breast reconstruction involving actually this technology. So we decide to use virtual simulation software where we simulate a breast reconstruction by mirroring the contralateral breast. This is not shown to the patient, it's just to create a mold. This kind of mold is a fenestrated mold that resembles actually a breast with a nipple complex. We use polylactic acid and we use last generation printers like this one. We obtain this kind of molds that are used during the surgery for the shaping of the flap. And in that way, we can obtain very symmetrical cases of breast reconstruction. Another case, the mold used during the surgery for shaping the flap, and a very good result in terms of symmetry. Who are candidates? Those patients that are going unilateral breast reconstruction, who have an appropriate donor site volume, there are no willingness to modify the contralateral breast, and in those cases of delayed breast reconstruction, or in those cases, the immediate breast reconstruction, but with asymmetric breast. The advantages by using this simulator is that it's a low cost and it's a relatively fast procedure. It's useful in less experienced surgeons. It facilitates the breast shaping in terms of volume, shape, and orientation, reducing surgical time and avoiding or reducing surgical revisions. This has been published last year in the Aesthetic Plastic Surgery Journal. And as conclusions, we can say that we all know that the recreation of the breast requires insight and skill. The use of these biomodels or custom molds allow us to optimize results in less operating time and avoiding or reducing the need of revision. The simulator software is a great alternative to more expensive technology. And as the 3D printing is becoming more precise, faster, and cheaper, we consider that it is an excellent tool in selected patients. We also would like to take this opportunity to invite all of you to the first ICOPLAS World Congress that's going to be held in Peru next year. You are all welcome. Thank you very much for your attention.